At one time or another, most people experience headaches. We spoke with Dr. Susan Sharp of St. Joseph Hospital in Orange to find out how a headache can be prevented and when a headache should be evaluated and treated by a physician.
There are classically three different types of headaches: migraine, tension type, and cluster headache. A cluster headache is typically occurs in men. It is a unilateral headache. It's severe debilitating pain. Cluster headaches can occur in the eye and in the jaw area. You can have redness of the eye, drooping of the eye, and tearing of the eye. But you can also have migraines that occur behind the eye. Those headaches are differentiated from migraine in that they're throbbing in nature. They're intermittent, they're throbbing, they're associated with nausea, vomiting, sensitivity to light and sound. Whereas the cluster headache, typically the patient wants to pace the room. In a migraine headache, the patient would want to lie down in a dark, quiet room. Migraines are predominantly in the female population, and they're severe, debilitating pain also. They're intermittent, they can occur continuous, they can be associated with your menstrual cycle, they can be associated with stress. Post-stress typically will trigger a migraine. Patients who maybe eat nitrates, if they have sleep interruption or delay in food intake, they may trigger a migraine. The tension headache is going to be a bilateral headache. It's going to feel like there's a band connecting both sides of their head, and it's going to feel like there's a vice or a squeezing of their head. It's a constant pain. It's not stab-like, like the cluster, or throbbing like the migraine. It's not associated with light sensitivity or sound sensitivity or nausea typically. These headaches can occur on a daily basis and are typically relieved by anti-inflammatories or sometimes muscle relaxants. It depends on what type of headache. Number one, avoiding the stressors. For example, cluster headache, the trigger of cluster headaches typically is alcohol. The trigger of tension type headaches is stress-induced. And the triggers of migraine, as discussed earlier, are the nitrate products in your food, lack of sleep, missing meals. And so typically you would start with a simple anti-inflammatory like a Motrin in the muscle type tension headaches or the migraine headache. However, it depends on if you're acutely in a headache or if you're trying to prevent a headache. The abortive therapies for migraine and cluster headaches are typically NSAIDs, the non-steroidal anti-inflammatories, and triptans, such as Emitrex and Relpax. They're evolving as we speak. They're getting newer and newer drugs, quicker and quicker onset. The route of administration varies, and you might want to check with your physician to see what type works best for you. And those are abortive therapies for headaches. The preventive therapies could possibly be calcium channel blockers, beta blockers, and anti-inflammatories. So you'd want to check and see which one works best for you. Typically we go through a course and try. How many headaches are you getting? How often is it occurring? Do we need to go for a preventative route versus just abort that occasional painful headache?